Alright, so let's look at the cranial bones. So we're going to start with the frontal. This is the frontal bone, parietal, occipital, and on the occipital bone we have the external occipital protuberance, which is down here, and that gives attachment to the ligamentum nuchae. Then we have the temporal bone over here, and from an external view we can see the temporal mandibular joint, which is up here at the top of the mandible. We can see the mastoid process, this part, the styloid process, which is right in there, and the external acoustic meatus, which is right there, where sound goes in, and then the squamous part is right there. Internally, we can see the petrous part of the temporal bone, which is right here. And it contains the middle and internal ear cavities, which contain sensory receptors for hearing and balance. And then we can see the internal acoustic meatus from the inside. That'll be right here. And through this, cranial nerves 7 and 8 pass through. Now, going on to the sphenoid from an external view. Let me put this back on. Alright, so the sphenoid is found in the orbit area right there, and also can be seen laterally right over here. And so the superior orbital fissure, which would also be on the inside, it would be an opening, that contains a lot of nerves and veins that pass through. And so going on the inside, we can see the lesser and greater wing of the sphenoid right here and here. That's the lesser, that's the greater. And the optic canal is right above here, right there. And then we can see the sella turcica, which it looks like a saddle, and that is where the pituitary gland is. Alright. We can see the internal view of the ethmoid bone, which is up here close to the frontal part of the skull. And then you have the crista galli, and that helps secure the brain in the cranial cavity. And then you have the cribriform plate right there, and the olfactory nerves pass through that. Now we're going to look at the sutures. This first suture is the coronal suture, and that connects the frontal bone to the parietal bones. Then you have the sagittal suture, and that connects the parietal bones. You have the lambdoid suture, and that connects the parietal and the occipital bones. And then the squamous suture is over here between the temporal and the parietal. Now we're going to go on to the facial bones. We have the maxilla and the alveolar process, which are bones that secure the teeth. Then you have the nasal bone, and then the zygomatic bone right here. And so the two bones that make the zygomatic arch right here are the zygomatic process of temporal bone and the temporal process of the zygomatic bone. And then the ethmoid bone would be inside the orbit. The vomer is here. And so the two bones that make up the bony nasal septum is the vomer and the perpendicular plate of the ethmoid. Now, moving forward, we can see the inferior nasal concha, which would also be inside here. The skeleton really doesn't show that. And that actually helps to swirl and filter air entering the nasal cavity, trapping particles in mucus before air gets to the lungs. So now we have the mandible, which is the jaw. Here's the body. And the angle, let me just flip my page right here. There we go. The mandibular angle is right here. The ramus would be in here. The notch kind of forms like a U right there. The condylar process and the coronoid process makes this arch up here. Now we're going to look at the vertebral column. So the vertebral column has 4 curves. You can see one here, the cervical area. The thoracic area has a curve. The lumbar region has a curve. And the sacrum has a curve. Now the primary curves occur on the thoracic and the sacral regions. And the secondary, therefore, would be the cervical and the lumbar. So the cervical vertebrae has 7 vertebrae. So the first 7 would be a part of that. The atlas is the very first one. It is quite different than the rest. And it correlates, it articulates with the occipital condyles of the skull up in there. And these vertebrae help us make the yes motion. Now, what the question is what is unique about the transverse processes of all cervical vertebrae compared to those of thoracic and lumbar vertebrae? Well, they have transverse foramen, which vertebral arteries pass to the brain. Now, going on to the thoracic vertebrae, there are 12. And so we're going to point out the different areas of the vertebrae. Now this is the spinous process, the transverse process. The intervertebral foramen would be the little openings that it's kind of hard to see in the video, but there's openings in there. And that's where spinal nerves and blood vessels pass through. The body is right here. And then you have the intervertebral discs, which kind of make stripes down the vertebrae. Now we got the lumbar vertebrae, and there are 5. There are 5 lumbar vertebrae, and then you have the sacrum, which are 5 fused bones together, and then you have the coccyx, which is the tailbone. Moving forward, we have the sternum, which this is the manubrium, the body, the xiphoid process, and the jugular notch. Right there, that's the sternum, and the ribs are connected to this sternum. Now the ribs, there are true and false ribs, and then floating ribs. The true ribs are the ribs 1 through 7. So 1, 2, 3, 4, 5, 6, 7. Those are called true ribs. And then the rest of them, 8 through 12, including the floating ribs, are false ribs because they either indirectly connect to the sternum or not at all. And so the head of the rib would be here, the neck would be here, and the where is it? The tubercle of the rib would be right there. And so the head of the rib fits into small depressions located on the centrum of the adjacent vertebrae.